Hi guys! Thank you for joining me today for our Lunch and Learn webinar. For those of you all that do not know me, I am Rebecca and I am a PTA down at our Cherokee location, and I am really excited to present to you gender-based medicine. It was a topic of one of my recent class projects, and it was something that I figured that we could all as therapists learn something about. I was talking to my clinical coordinator Tracy about it, and he kind of passed it on to Jamie, and we thought that this would be a great opportunity for you all to get some background information, just a little bit of stuff to learn, and then go from there. I'm going to be talking about a couple just basic things that have to do with gender-based medicine. There will be a pamphlet that I have emailed to each of your work emails. That way you have the information that I'm going to go over. You also have a little bit more in-depth information. We don't want this to be a very long webinar. It is our lunch and learn. We want it to go pretty quick because I know you all have stuff to get caught up on, and I don't want to take up too much of your time. With that being said, we're going to get started. So from the beginning, I want to start off and ask how many of you all can tell me what the difference between sex and gender is? Very cool. I see a few hands. Some of you know what the difference is, and then some of you kind of give me the look that I kind of probably made myself when I started to think about what I thought the difference between sex and gender are. So we're going to start off, I'm going to use a definition from my textbook. Sex is usually defined as the hormonal and the anatomical differences between men and women, where gender, on the other hand, is a very much more fluid term. It's often set by the culture that you live in, and it's usually what you identify yourself as. This is where you tend to see gender used more, especially now when people identify as different genders compared to their sex that they were born with. So the next thing we're going to go over is some of the simple differences between men and women, biologically and behaviorally. So let's start with behaviorally. Most men, we're going to start with the men, they are more dominant, more aggressive, more decisive, and more outgoing than women. And a typical woman are more soft-spoken, indecisive, a little bit more anxious. However, there's starting to be a little bit of a mesh between men and women. Women are starting to find their voice more, especially in America. It is encouraged in America for women to be more outspoken and more independent than in some of the other countries. The biological differences that I really want to talk about. So starting basic biology for men and women. Women have 2 X chromosomes, men have an X and a Y, which that's just basic biology. But part of the biological differences that we have is there's some structural and some mechanical differences between men and women. Women tend to have more ligamentous laxity, hormonal influences. They have a higher Q angle, which is just a way to measure the force of the quadriceps. It takes the ASIS and the midpoint of the patella, and you make a line. So women have a bigger Q angle. They also have an increased tibial and a tibial torsion and a femoral anteversion. Both of those are just an inward rotation of the femur or the tibia. And then women also tend to have wider hips. Normally men have all of the opposite of those type things. Occasionally you will see a man with a little bit of wider hips, or you'll see them with increased ligament laxity. So, those, for us, those are the big ones that are biological that we would normally deal with as physical therapists, physical therapist assistants, and athletic trainers. So those are the big ones that I chose to focus on just because that's how we get our injuries that we see. The ligamentous laxity leads to higher rates of ACL injuries in females. The hormonal influences for females are also a huge part of what we see, especially when a woman becomes pregnant. The hormones that come with pregnancy usually end up causing extreme ligament laxity. So that's something that we usually deal with as a profession. So I want to take a minute to focus really on the biological differences. So within the past year at my clinic, we've had a high school student who has come in, and their sex is male, but their gender is female. So this patient is transitioning from male to female, and it's something that we don't see a lot of in our clinic, especially in our area. It's not, we don't have a very big presence of transgender people in our area. So this is something that I feel like we need to address, especially when it comes to talking about gender and sex. So let's get into this a little bit. When the patient came in, they looked female, they had a female name, however, their sex in the medical chart was listed as male. So that was kind of something that threw us off a little bit. We thought at first it was a typo. We asked our front desk. They said, no, it's right. The grandmother already informed the front desk that the patient was in the process of transitioning. And they were coming in because they were having back pain, hip pain, knee pain, shoulder pain, just all kinds of really just achy pains. So the PT took the patient back for the evaluation. The PT and the patient talked, and come to find out, the patient had started taking hormone for the transition. So when taking the hormones for this transition, they were now becoming more female, having more female hormones put in, which was affecting all their ligaments. As I stated before, females have more ligament laxity. It has a lot to do with our hormone makeup. So this was something that this patient had never dealt with before. The back pain, the knee pain, hip pain, shoulder pain was all coming because their ligaments were becoming more lax because of the hormones that they were on. So that for me was kind of interesting. I had never thought of it. I just, it was something that has never crossed my mind because we've not really ever had a whole lot of transitioning patients come in. So with that being said, for a therapist, I think it's important to know the difference between the males and females in situations like this. It's important to know how much difference hormonal transitions can be on different patients. So I think this will help us, knowing stuff like that will help us in the future when we treat patients, especially if we have a transgender patient come in. We will actually have some background information and know how to treat them that will be best for the patient. We also have to kind of look at the difference between male and female and how they respond to preventative care. We don't do a whole lot of medical preventative care. We do a lot of musculoskeletal preventative care as PTs, PTAs, and ATCs. So really the only thing you would want to know about that is that men and women both react differently to preventative care. Some of the biggest stuff right now is drugs, medical drugs, prescription drugs, stuff like that. Women, come to find out, actually hold liquids and solids longer, making the ability to absorb stuff greater. So as a woman, I would absorb something longer, over a longer period of time, and get a better effect out of it than a male who doesn't absorb as quickly. So that's something to consider. Another thing about this that you kind of may want to look into is that there is not a lot of good information out about the differences between males and females when it comes to medicine and treatments and all kinds of things like that. Also when it comes to diagnoses. So I think a good thing about us being part of our hospital is that we can get more research than just an outpatient therapy group. We could also work to get research and see research grants to see if we can actually help figure out differences on how men and women respond differently to physical therapy. And just kind of interesting things like that. Another thing that we need to talk about is the idea to advocate for our patients. We sometimes come in contact with our patients' doctors, trying to figure out what's best for them, what we need to do for them. And even mentioning something simple like how I mentioned the difference in the patient's absorption rates. Maybe something you need to tell your doctor if maybe you can't get their pain under control and you can't figure out why. We may also be able to advocate to our people that come in and sell us different products that are non-prescription, and see if they have any ideas about what works better for a man versus a woman based on the biologics of their products. It's something to consider, something to see if they even know, because there's not a whole lot of research out there between male and female, and it's very interesting. So I'm going to leave you all with that. If you have any questions, please feel free to contact me. Like I said, I will send out the email to all of your all's work emails that contain just kind of the big points from our little lunch and learn, and also talk to you about more information on what we can do, how it will affect us. And feel free to reach out to me. I kind of enjoyed talking about this topic. It was very interesting for me to learn the differences, because when I first started this, I thought, well, I treat a male and a female the same because I don't deal with the medications. When in reality, you've got to really consider the different forces, the different body types, stronger bones in men, weaker bones in women, different things like that to really do the best you can for your patient. So thank you so much for listening. I really appreciate it, and I hope you all had a great day.